Good day, ma'am. This is Tiffany Grace de Rapas, and today I will be presenting our review of related literature of our research, which entitled Factors Influencing Sanitation and Hygiene Practices Among the Restaurants of Ilongos Leyte. So this chapter includes the information, ideas, finished thesis methodology, and conclusion. The review of this literature for this study focuses in identifying the factor that influences the sanitation and hygiene practices of the restaurants, in which those included in this chapter helps in familiarizing information that are relevant and similar to the present study. Related literature. According to Pross Austin et al. 2014, inadequate drinking water, sanitation and hygiene, or WASH, are important risk factors, particularly in low-income settings. In 2011, an estimated 768 million people relied on improved water supplies, which are thought to have high levels of pathogen contamination. Many more use sources that are classified as improved but still unsafe for consumption. More than 2.5 billion people lack access to an improved sanitation facility. Inadequate hand hygiene practices have been estimated to affect 80% of the population globally. Estimating the impact of WASH on diarrheal diseases has commonly been assessed with comparative risk assessment methods, although other methods such as population intervention models could also be considered. Other diseases cannot currently be estimated with such method due to insufficient evidence and require alternative approaches. As this would require considerable additional assessment and analysis, they are not analyzed in detail in this article. Accrual of substantive recent evidence, as well as trends in the total of diarrheal burden, justifies the revision of methods and estimates of the burden of diarrheal disease associated with inadequate WASH. While the estimate presented focuses mainly on low and middle income settings, the approach used can accommodate a wider range of settings. An overview of previous findings on the impact of WASH on other diseases than diarrheal is also provided. According to Pross Austin et al. 2002, the Global Burden of Disease Study, or GBD, estimated the burden of 107 major diseases and 10 risk factors at global and regional levels. Using an internally consistent approach, estimates were reported in summary measures of population health combining mortality and morbidity. In terms of the disability adjusted life year, or DALY, this initial approach has prompted a series of replications at the individual country level. Such assessment provide an important input to the rational development and evaluation of policies by the health sector and activities of other sectors that directly manage or influence the determinant of health. Additional information required for the rational development of such policies and activities includes the effectiveness and cost-effectiveness of interventions, social considerations, and the availability of resources and the type of policy environment. Information on disease burden relating to risk factors rather than diseases is likely more relevant to the policy because it may allow actions to be directly targeted to modify exposure. As a result of increasing interest in such risk factors, the World Health Organization is currently involved in assessing the disease burden of about 20 risk factors in an internally consistent way. 6 of these risk factors focus on environmental and occupational health concerns, one of which is water, sanitation, and hygiene. The risk factor water, sanitation, and hygiene, as investigated here, comprises a number of interrelated transmission pathways composed of competing or complementing events for causing disease. The number of the resulting disease is large. Fecal-oral diseases account for an important part of this disease burden and are the main focus of this article. Human and animal excreta can affect human health through drinking water, sewage, indirect contact, and food through virus pathways. This first exposure-based assessment of disease at the global level should therefore be considered an initial estimate, which will undergo refinement as additional information becomes available. The research paper presented above mentioned relevant data and information about the factors that influence or that affect sanitation, and most of the data presented were not quite far from each other. The researchers always mentioned about the impact of improper sanitation. That's why the goal of this research is to indicate and mention all the factors that affects sanitation, especially in the restaurants, specifically in Hilongos in connection to the hospitality industry. And that's our review of related literature or RRL for our research. Thank you for listening.